Alright, so the first method will be using a biopsy probe. So just wipe some of the slime away from the cheek. That just helps reduce contamination. And then using a sterile scalpel, we can slice some of the scales away from the cheek. Just between the scales and the skin is where you want to go. And take your biopsy punch. This is the one with the plunger in it. Put that into the flesh. If the fish is frozen, sometimes it helps to twist it as it goes in. Once it's in, you can rotate it like that, and that dislodges the flesh. And then you take your sample out that's in the tip of it there. Once you've got your sample, you just have to plunge that into the tube. That's it there. Make sure the lid goes on nice and tight. Alright. Next method, we take a similar type of sample but using a scalpel. So this is just for a demonstration, but what you would usually do is sterilise that scalpel following one of the procedures. So again, you can slice the scales away. Now you can do this anywhere else on the fish as well. It doesn't have to be up there. Once you've sliced those scales off, clean the scalpel again in the sterile solution. And then you can cut a very small piece of the flesh away using that scalpel. You can use tweezers as well, but generally I find it easier just to use the scalpel. So with this one, it's a little bit easier to oversample, so just make sure that the level on the ethanol tube doesn't go all the way over these rib lines, and that just tells you that you've not taken too much sample. Alright, and the last method is fin clip. Obviously you wouldn't do this with a fish that's been sitting in a brine, but if it's just been brought over the side or that you want to release it, this one works pretty well. So all you have to do is, with your tweezers or your forceps, take a sample like that, and place it in the tube.